So, good morning, everybody. Welcome to Security Health Plan Academy, Security's monthly webinar series created to provide you with information relevant to your health, wellness, and healthcare plan. This month's topic is not meant to scare you, but to make you aware of the impact oral health has on overall wellness. Today, you'll learn about the prevalence of gum disease and the connection between oral health and your overall health. You'll also gain a better understanding of the dental benefits offered through Security Health Plan's Medicare Advantage plans. We've sourced a true expert to tackle our October topic, Delta Dental Key Account Specialist Kelsey Kotke. Kelsey joined the account management team at Delta Dental in 2018. She has a passion for improving the oral health of Wisconsin communities and has found great joy and purpose in collaborating with Security Health Plan to create the most innovative yet affordable Medicare Advantage plan offerings. We received many questions in advance of today's presentation, and our responses to those questions will be included in the follow-up communication sent later this month due to the length of today's session. You are still welcome to submit your questions via the chat feature, and we'll address them if we have time at the end. Otherwise, you can expect a response from us in the follow-up communication. All right, I think we're ready to get started. So without further ado, please join me in welcoming Kelsey to the webinar series. We're excited you're here and eager to hear what you have to say.
Great. Thank you so much for the introduction, Ashley. There is certainly a lot to know and understand about Medicare, so I appreciate the invitation to participate in Security Health Plan Academy. It is a great way to share information and resources. Now, while I imagine retirement is an exciting time, I recently watched my parents navigate the Medicare enrollment process, from experiencing long wait times at our local Social Security office to sifting through countless plan options. The process definitely seemed to suck some of the joy out of retirement planning. However, Security Health Plan has offered me and many others comfort through their expertise and guidance during what can be an overwhelming time. I have had the privilege of collaborating and strategizing with Security Health Plan for the past few years to ensure members like you have access to quality dental care within and in addition to your Medicare Advantage plans. While I'll wrap up today's webinar by providing some details with regards to the dental benefits available within and in addition to Security Health Plan's Medicare Advantage plans, we'll first talk about periodontal disease. What is it? Who it impacts, and its cause and cure. Second, we'll take a look at how it relates to other diseases. And lastly, in light of the information presented today, I'll provide you with some suggestions and recommendations about how you can take ownership of both your oral and overall health all at once. Without further ado, we will talk about periodontal disease. Periodontal disease is the clinical name for gum disease. It's a bacterial infection that affects the gums, bone, and ligaments that surround and support your teeth. As we'll discuss in upcoming slides, the symptoms of periodontal disease can range from swollen gums to tooth loss. As you can imagine, the mouth is an ideal environment for bacteria to grow and thrive. It's dark, warm, and wet. Interestingly, there are over 700 species of microorganisms, like bacteria, that live in your mouth. To take it even further, while the population of these 700 species is difficult to determine, it's thought that the bacterial population in the mouth alone is around 6 billion. While this may be gross to hear, don't worry, we all have them and they are mostly harmless and well controlled by our body's natural defenses, as long as good oral hygiene is practiced. While there may be many types of bacteria within the mouth, only about 12 species are considered bad and thought to be the primary causes of periodontal or gum disease. These bad bacteria form a sticky film on your teeth called plaque, which releases toxins into the body. Whenever a toxin, a virus, or a germ is detected within your body, your immune system responds by sending inflammatory cells to fight them. These cells begin an inflammatory response to trap germs or toxins and start the healing process. While oral inflammation can cause pain, swelling, or gum discoloration, it's actually a good sign that your body recognized an issue and is seeking to resolve it. Similarly, when you experience a fever, while it doesn't feel good, it's your body's way of recognizing and combating an infection. So, in the case of gum disease, bacteria forms plaque, which releases toxins. Your body detects these toxins, responds with inflammatory cells, which of course causes the swelling of your gums. It's all a balancing act between bacteria and your immune system. If your immune system is healthy and strong, it'll defeat the bacteria and your symptoms will improve. However, on the other hand, if your immune system is weakened, it'll lose the battle against the bacteria and your symptoms will persist or even worsen. While infections cause inflammation, other factors such as poor diet, stress, and genetics also have the power to either strengthen or weaken your immune response. Take poor diet, especially one high in sugar, for example. Some of you may have heard of the Whole30. The Whole30 is an eating program during which you eliminate added sugar or alcohol, among other things, from your diet for 30 days. You later reintroduce these foods or beverages back into your diet one at a time to identify food sensitivities that you may have not been previously aware of. If you browse Target's book section, you'll see a variety of books about the Whole30, including cookbooks. A few winters ago, I did the Whole30. Rather than reintroducing certain foods back into my diet one at a time, though, I overindulged on Christmas cookies and spiked eggnog. The next day, my body felt sore and stiff as if I was recovering from an intense workout. After doing some research, I found out that I had what was called the sugar aches, which is an internal inflammation caused by sugar. I give this example simply to reinforce the fact that our bodies are constantly on the lookout for threats, releasing these inflammatory cells to mitigate them. Eating food that's high in sugar, smoking cigarettes, excessively drinking alcohol, or taking certain kinds of medications can create unnecessary inflammation and weaken our immune system's response to threats. While you can control what you're eating and drinking, some factors like genetics are out of your control. Genetics may determine what kind of bacteria is present in your mouth, how strong your immune system is, or your susceptibility to other diseases like diabetes. For example, my sister was in her late 20s at the time with no health issues, but she noticed that her gums were receding and she needed to get grafting done. This was likely caused by genetics, as my father needed a similar procedure done when he was young. The most common signs of gum disease are gum swelling and bleeding. However, your dentist may also measure pocket depths between the tooth and gums or order x-rays to look for bone loss. This slide here shows the 3 stages of gum disease: gingivitis, moderate gum disease, and advanced gum disease. If your gums ever bleed when you floss or brush, it could be a sign of gingivitis. When caught early in this stage, the disease is completely reversible with just routine cleanings. However, if you're diagnosed with either moderate or advanced gum disease, treatment usually lasts a lifetime, as it's a chronic disease that does its damage slowly and constantly over time. If moderate disease is present, a more thorough cleaning called scaling and root planning may be necessary. Antibiotics may also be prescribed, along with more frequent maintenance cleanings to prevent the disease from progressing. If diagnosed with advanced gum disease, your teeth may be loose and at risk of falling out due to the severe bone loss and deep pocket formation. Treatment of more advanced disease may require gum and bone surgery, like grafting gum tissue over exposed tooth roots, applying splints to prevent teeth from loosening further, or extracting teeth and replacing them with expensive implants. An important thing to note about implants, though, is that they can be impacted by gum disease just like a natural tooth. With that said, your doctor will only suggest implants if your disease is under control and bone loss is not severe. Who does periodontal disease affect? According to the CDC, gum disease affects over half of American adults to some degree, making it one of the most prevalent diseases worldwide. While half of American adults have gum disease, the CDC estimates that only about 6% of people are getting gum disease treatment. While gum disease impacts almost half of the population's oral health, it also affects more than just your mouth. Because the mouth is the primary pathway into the body, it's not hard to understand how oral health can be impacted or impact other functions within your body. We at Delta Dental of Wisconsin talk about the link between oral and overall health quite often. I don't think anyone disputes that this intuitively makes sense. However, I don't think many people understand just how important this is. So I'd like to take just a few minutes to connect the dots with you. More and more studies are being conducted and published, showing the connection between oral health and overall health. Shockingly, more than 90% of systemic diseases are linked in some way to oral health. Systemic diseases are health conditions affecting one or more of the body's systems versus a single organ or body part, and include diabetes, multiple sclerosis, heart disease, high blood pressure, Crohn's disease, and muscular dystrophy. So why is gum disease so commonly associated with other diseases in the body? The common element is, as we've discussed, inflammation. While inflammation is the body's way of recognizing and fighting recognized threats, it can harm you if it occurs in healthy tissues or goes on for too long. Chronic inflammation is when your body continues sending those inflammatory cells even when there's no danger present. With chronic inflammation, processes that normally protect your body actually end up hurting it. Chronic inflammation can last for months or years, and while you may have periods where your condition improves, there are also times when it gets worse. This slide shows some examples of the oral and overall health correlation from head to toe. We'll start from the top with your brain. Uncontrolled gum inflammation can negatively impact cognitive function. For example, studies have shown a connection between the bad bacteria associated with gum disease and the progression of Alzheimer's disease. Toxins released from inflamed gums can kill brain cells, contributing to memory loss and cognitive issues. Moving down to the lungs, poor oral health can also impact the respiratory system. According to Babylon Dental Care, bacteria in the mouth from infected teeth and gums can be breathed into the lungs or travel there through the bloodstream. Once there, the bacteria can lead to respiratory infections, pneumonia, bronchitis, and even COPD. When it comes to cancer, obviously poor choices like smoking or chewing tobacco can lead to oral and throat cancers, but other types of cancer have been linked to gum disease as well. The risk for kidney, pancreatic, and blood cancer is higher for people who have poor oral health, according to the Vermont Health Equity Initiative. For those of you who are or will become grandparents, encourage your children to take care of their oral health, as uncontrolled gum disease can also lead to pregnancy complications like premature birth and low birth weight, and also sometimes infertility issues, according to the CDC. Let's touch on diabetes, heart disease, and arthritis more in depth in the next few slides. Again, while half of American adults have gum disease, over 30 million Americans have diabetes. The working relationship between these two diseases may be the strongest of all the connections between the mouth and body. Diabetes and gum disease have a two-way relationship. People with poor oral health are more likely to develop diabetes or have uncontrolled diabetes, and vice versa. People with diabetes are more likely to have gum disease. Gum disease affects nearly 22% of all people with either type 1 or type 2 diabetes. While good dental care can keep the bad bacteria inside your mouths in check, diabetes does have the power to upset the natural balance within our bodies, including our mouths. While diabetes upsets the natural balance within our bodies, there's comfort in knowing that those that are diagnosed do have some control. As previously stated, diabetics that improve their blood sugar control can improve their gum disease health as well. Studies show an average HA1C reduction of just under 1%. 91% of patients with heart disease also have gum disease. Just as bad bacteria can travel through the bloodstream and cause respiratory infections, it can also cause blood flow problems and blockages due to hardened and clogged arteries, leading to an increased likelihood of strokes and heart attacks. People with gum disease are 2 times more likely to die from a heart attack and 3 times more likely to have a stroke than those without. Blood pressure may also be heightened in people with gum disease, as the inflammation in the mouth causes inflammation in the blood vessels. Inflamed blood vessels allow less blood to travel between the heart and the rest of the body, thus raising blood pressure. Arthritis. Now, according to the National Rheumatoid Arthritis Society, people with gum disease were 4 times more likely to have arthritis. As many of you know, this is a painful and debilitating inflammatory disease caused when inflammatory cells attack and damage joint tissues in error. Again, both gum disease and arthritis have inflammation in common. Uncontrolled oral bacteria and oral inflammation are likely to lead to increased inflammation throughout the body. This slide shows how much someone could potentially save in medical costs if they get the appropriate gum disease treatments, and how significantly hospital admissions can be reduced by getting the appropriate dental treatment. Diabetes is the most impacted, but you can see there are other correlations in areas like coronary artery disease and cerebral vascular disease. While this slide shows how proactively and persistently investing in your oral health impacts medical savings, it's important to state the obvious fact that high dental expenses can also be avoided. As previously discussed, if you are diagnosed with gum disease and do not control it with regular cleanings or dental visits, it could progress into advanced gum disease, which could require tooth extractions and implants. If anyone here has ever needed an implant, you'll know that implants are costly services ranging anywhere from $4,000 to $5,000. Investing in your oral health now will prevent the need for major oral surgery and expensive dental treatments, in addition to reducing your medical expenses. Now that we know the prevalence of gum disease, systemic diseases, and how they connect to one another, what now? What are some simple things we can do to take control of our oral and overall health and continue to live healthy lives? By taking advantage of your robust dental benefits, enjoying a well-balanced diet, and exercising regularly, your oral health will either be maintained or improved, with your overall health following suit. If you are enrolled in the Spirit, Compass, Legacy RX, or Essence RX plan, a cleaning, exam, and x-ray are covered each year. If you desire more coverage, you're able to purchase an optional supplemental plan through Security Health Plan for $43 per month. This optional plan covers an additional exam and cleaning, a fluoride treatment at an 80% coinsurance level, and other services like fillings, crowns, oral surgery, implants, and dentures at a 50% coinsurance level, up to a $1,500 annual maximum. Services that are not diagnostic or preventive in nature are subject to a $100 deductible. If you use your full $1,500 annual maximum in 2025, it will reset come 1/1/2026. While the Esteem RX plan includes the same preventive-only dental benefits included in the Spirit, Compass, Legacy RX, and Essence RX plans currently in 2024, that will not be the case in 2025. The Esteem RX plan is Security Health Plan's zero premium plan that not only covers prescription drugs, but also, come 2025, comprehensive dental benefits. The dental benefits included in the Esteem RX plan are similar to what's available in the optional plan, except it does not require a deductible for any services and includes a $1,000 annual maximum versus a $1,500 annual maximum. If you are enrolled in the Esteem RX plan, you are still welcome to enroll in the optional dental plan if you feel additional coverage is necessary. If you enroll in the optional plan, you'll essentially have an additional $1,500 to use, a total of $2,500 annual maximum dollars to use on covered services. One thing to make note of is the EBD program is associated and included with the Esteem RX plan and the optional supplemental dental plan. This program is the evidence-based dentistry program and allows anyone that has one of the qualifying conditions noted on this slide to receive 2 additional cleanings and 1 additional fluoride treatment per year. By calling our customer service team and disclosing your condition, your record will be updated to cover up to 4 cleanings or up to 4 fluoride treatments per year. And your proof of condition is not required. Please note that in order to utilize your dental services, you must visit a provider who participates in Delta Dental's Medicare Advantage network. As of yesterday, there are a total of 1,719 access points here in the state of Wisconsin. That's almost 100 more access points than we had at the start of the year, thanks to our local provider relations team's continual recruitment efforts. When comparing the addresses of Security Health Plan's members to the addresses of our Medicare Advantage providers, it was confirmed that 99.9% of members have access to a Medicare Advantage provider within 15, 30, or 45 miles, depending on if they live in an urban, suburban, or rural area. As those of you that live in a rural area very well know, while rural living comes with limited traffic, decreased crime, and peace and quiet, your access to things like dental specialists, Chick-fil-A, or home goods isn't as broad as those who live in suburban or urban areas. I will talk about what Delta Dental of Wisconsin and our local government is doing to address dental access issues in rural areas in just a few minutes. You can locate a Medicare Advantage provider near you using our online provider search tool or by calling our customer service team. Our customer service team can either provide information to you over the phone or mail you a provider listing. Our online search tool is updated every 24 hours to ensure accuracy. If you learn that the dental provider you've come to know and love does not currently participate in our Medicare Advantage network, Delta Dental's provider relations team is happy to recruit them on your behalf if they're interested in participating. Our online provider search tool can also be accessed via the member portal. If you register for access to the portal, you'll have 24/7 access to other tools and resources like electronic ID cards, EOBs, and more. The link on this slide will bring you to the registration page. While this presentation includes high-level information about the dental benefits made available to you through Security Health Plan, more details can be found on Security Health Plan's website on the Member Documents page. On this webpage, you can find the Delta Dental Member Handbook, which contains details regarding all covered services, as well as any exclusions or limitations that might apply. It also includes documents like enrollment forms, directories, and Q&As. If you'd rather not access information online, though, you are more than welcome to call Security Health Plans or Delta Dental's customer service lines with any questions or concerns you have regarding any benefit that's available to you. While Delta Dental prides ourselves on developing and growing a robust provider network to benefit our members, I'd be remiss if I didn't acknowledge concerns that have been raised in Wisconsin and nationally with regards to rising dental care costs, as well as workforce, specifically dental hygienist shortages. Action is being taken. Nationally, surveys have shown that 1/3 of dental assistants and dental hygienists expect to retire within the next 5 years. To be proactive in fortifying the workforce to avoid further oral care access issues, both Delta Dental of Wisconsin and our local state have responded to this challenge. In January of this year, Governor Tony Evers signed Wisconsin Act 89 into law, which allocates $20 million for oral health care workforce initiatives at Wisconsin's technical colleges. Delta Dental of Wisconsin has pledged to match up to $2 million of the state's funding of these initiatives, as we believe in expanding access to dental care, ensuring a strong dental workforce, and improving the oral health of our communities. This legislation provides funding for the creation or the expansion of dental assisting, dental hygiene, and dental therapy programs. For those of you that don't know, Delta Dental of Wisconsin also has a loan repayment program in which they award two graduated dentists $100,000 for loan repayment if they choose to work in a dental shortage area. In addition to allocating funds to be used for programs to expand access, states including Wisconsin have authorized dental therapy. Dental therapists are mid-level providers who perform unlimited scope of services. They perform less services than a dentist, but more services than a hygienist. They're basically a physician's assistant, but in the dental world. They can perform exams, fillings, temporary crowns, and non-surgical extractions, which will allow dentists time to perform more complex procedures. After the completion of their education and receiving their license, these therapists would perform 2,000 supervised hours and later enter into a collaborative management agreement with a certified dentist. They would also be required to practice in a dental shortage area or at a clinic where at least half of the patient base is underserved. In states where dental therapists can practice, it has proven to reduce appointment wait times, increase the number of patients who can be seen, and lower emergency room visits for dental treatment. Access to dental care is a critical issue across the entire country, especially in rural areas. So adding dental therapists will help improve access to care for all, not just the underserved. Lastly, Wisconsin joined Washington, Tennessee, and Iowa in the Dentist and Dental Hygienist Compact. This allows a provider that's licensed in one compact state to practice in other compact states. The compact will only become effective when at least 7 states have enacted legislation entering into the compact. While Wisconsin is only the 4th state to ratify the compact, there is legislation pending in a dozen additional states. Again, this will impact access to care and the oral health workforce by allowing providers in Minnesota, for example, to perform services in northern Wisconsin. With all of this being said, please know that Delta Dental hears you and is doing all that we can in partnership with the state and Wisconsin Technical Dental Colleges to continue to expand our network and the oral workforce. Again, as we continue to contribute to this improvement, if you do have a dental referral, please feel free to pass those to us, and we are happy to reach out to your providers for recruitment purposes. Transitioning away from visiting in-network providers to take advantage of your dental benefits, let's talk briefly about nutrition and exercise. I don't think anyone would argue that nutrition plays a vital role in both your oral and overall health. This slide contains 5 recommendations to consider. First, drink water. Reducing sugar and avoiding the inflammation that comes along with the sugar aches is key to maintaining a healthy diet and preventing tooth decay. Second, snack sensibly. Reach for fresh fruit, a piece of sugar-free gum, or dark chocolate rather than chips, cookies, or ice cream. As we prepare for trick-or-treating, you may consider giving out dark chocolate versus milk chocolate, as it contains less sugar and actually contains compounds that strengthen teeth enamel and dentin. Enamel is the hard outer layer of your teeth, while dentin is directly underneath the enamel. Both of these layers must be strong to have healthy teeth. According to a recent study, as the concentration of dark chocolate increases, there is a corresponding increase in the hardness of both enamel and dentin. This enhancement is attributed to the presence of numerous minerals and antioxidants found in dark chocolate. This is great news for those of us with a sweet tooth. We don't have to give up all sweets in order to be healthy. Third, eat in moderation. Be sure to have appropriate portion sizes. While certain medical treatments like chemotherapy may make you feel sick and diminish your appetite, reducing your food intake too much and not maintaining a balanced diet can, of course, deplete your body of the vitamins and minerals necessary to have great oral and overall health. Malnutrition can lead to a weakened jawbone, softened enamel, and deficient gums, making you vulnerable to gum disease. Now, to ensure you're providing your body with an array of vitamins and minerals, be sure to vary your food groups. Calcium and phosphorus rich foods such as dark leafy greens, dairy products, fish, and eggs help promote strong teeth and bones. In addition, fruits and vegetables like watermelon, broccoli, and spinach are packed with vitamin C, which helps promote gum health. Without vitamin C, gums may swell or bleed, and teeth loosen or fall out. If you smoke cigarettes, know that your body may be unable to properly absorb the benefits of vitamin C, further contributing to your oral and overall health in a negative way. And lastly, many medications used to treat high blood pressure and overactive bladder and antidepressants may contribute to dry mouth, which leads to bad breath, gum disease, cavities, dental erosion, or infection. If you feel any of your medications may be negatively impacting your oral health, please consult your doctor. Nutrition and exercise often go hand in hand. As people get older, they may feel discouraged and lack motivation to exercise. I can tell you, as a healthy 30-year-old with an 8-month-old daughter, I often feel discouraged and unmotivated to exercise myself. So, fortunately, we don't have to run a marathon or qualify for the Olympics in order for our exercise to be considered quality. Simply moving your body when doing daily activities like brushing your teeth will suffice. Walking around, doing calf races, or wall sits while brushing your teeth every morning and evening allows you to kill two birds with one stone. Security Health Plan's Medicare Advantage plans in 2025 also include a health and wellness program called One Pass, which gives you access to gyms, offers online workouts, and has tools and games to keep your mind sharp. To learn more about how to take advantage of the many perks that are included in your Medicare Advantage plan, please reach out to your Security Health Plan contact. In conclusion, Delta Dental and Security Health Plan are truly committed to the oral and overall wellness of our members, their families, and communities. Again, I thank you for your time and your attention today and hope that you're able to take even just one thing away from today's presentation and apply it to your health. While we might not have time for questions today, please feel free to send any questions to your agent, Security Health Plan contacts, or Delta Dental's customer service team. I'm happy to continue this conversation.